A set of events that drive an individual to engage in criminal activity is known as a pathway to crime. The most common pathways to crime include antisocial behaviour, family violence, and neglect. Engaging in antisocial behaviour can also lead to dropping out and academic failure. Antisocial children may gravitate towards delinquent classmates, which may cause exposure to gangs and other forms of criminal behaviour, including vandalism, theft, and burglary, that influence a distorted view of right and wrong. They may be rewarded for their actions, which only influences and creates positive reinforcement towards committing crime, as juvenile offenders value the emotional height of violent offending over the concerns of getting caught or experiencing social disapproval. Experiencing family violence or neglect can lead to a variety of behavioural and psychological issues such as anxiety, depression, and post-traumatic stress disorder. This can lead to ongoing struggles with emotional regulation, violence, and impulsivity. Additionally, children who have been immersed in family violence and parental neglect can go into adulthood exhibiting similar traits, including violence towards family, friends, and themselves as a way to gain control over situations they didn't have control over in their childhood or adolescence. Kodoriki was sentenced to 7 years in jail for his involvement in Michael Cho's death in 2001, whilst having a history of antisocial behaviour including being expelled from multiple schools before turning 13 and involvement in burglaries and thefts.
This is my younger years. I started up with arson when I was a little kid. It all started off from trying to get attention from my family, trying to get that big dog status. Started off from there, and then it slowly kind of led on to bigger crimes like stealing, and then I started robbing houses and stealing cars. And usually it's just boys that I grew up with. It's year 5, grew up with them in the same neighborhood. Boredom and isolation were really the main ones. I had my partner go out for a gap year in the UK, and I just found myself bored. Nothing much was going on around my life, so I guess I was just as vulnerable as anyone else, being sucked into some crime circle for that excitement, that thrill. My partner, I had my first nephew on the way, my family, and the sadness that I brought to my own mother. She just saw me going down the road, and you know, if you really loved your parents, you would really feel their pain when they want you to turn that road around. No one. I actually noticed a lot of friends and people that I thought would fill that position for me didn't really show up. Jobs, it was so hard getting a job. Nobody even wanted to accept me for that first interview. I've had jobs taken away from me, contracts taken back. Just trying to stop myself from going back into the same circle, that same rotation, the same hole I was in. Letting those people in my life pull me back and keep me doing the same mistakes that I hit the first time around. It was hard for me to stop myself from going back to that.
The most effective time to intervene between antisocial behaviour development is during early and mid-childhood, when risk factors are shown to become more evident. In the United States, projects such as the National Gang Center have aimed to prevent antisocial behaviour and inform parents and schools about how to notice and manage it. It is also critical that teachers, schools, and parents become more aware of the indicators of antisocial behaviour and develop techniques to address it. Programs that emphasize social and emotional skills as well as academic accomplishment have been demonstrated to be helpful in lowering antisocial behaviour and increasing outcomes for at-risk youth. In New Zealand, it is clear by the large proportion of adolescents entering juvenile facilities, including Christchurch and Oranga Tamariki, shows that there is still not enough mental health work being done. New Zealand must work harder to prevent antisocial behaviour and family violence in children early on in childhood by raising concern when a child shows a pattern of physical injuries and looking deeper into behavioural changes.